Chronic failures in the health system of South Africa's Eastern Cape have been exposed by the pandemic, according to a BBC investigation. Key staff are on strike or sick with COVID-19. Nurses have been forced to act as cleaners in some areas, and there are reports of unborn babies who have died in overcrowded, understaffed wards. Exhausted doctors and nurses say the province's health system has collapsed under this strain, with one doctor calling it an epic failure of a deeply corrupt system. After initially controlling the virus, South Africa is experiencing a sharp rise in coronavirus cases, currently more than 10,000 new cases a day. It now has more cases registered than the UK, just over 300,000 just about, and the 8th most affected country in the world. Almost 4,500 people have died. That is far less so far than the UK total. Our Africa correspondent Andrew Harding sent this report from Port Elizabeth.
A windswept cemetery outside Port Elizabeth and a queue of hurried burials as COVID-19 finally surges across South Africa. But already this troubled city's health system is close to collapse. We've uncovered shocking evidence from two filthy, chaotic state hospitals. Here, security guards cover for absent medical staff as a sick man is hauled into casualty. Inside Livingston Hospital, essential cleaning, laundry and some nursing staff are refusing to work.
Was soiled in linen, was found all over the hospital or passages. There was blood on the floor. We cannot risk the lives of the nurses. They are human beings.
But that means just a handful of doctors and nurses are left, overwhelmed. Fearful of being sacked for speaking out, staff asked us to hide their identities.
There's a shortage of staff, so you end up nursing 50 patients and more. We are living in fear.
And there is plenty to fear here. Rats converge on blood and other waste in an open drain. Inside the hospital, patients have come to blows over scarce oxygen supplies.
There are reports of patients fighting for oxygen, limited bed capacity, limited staff, and services are starting to crumble.
4 medics have independently confirmed to us that at least 2 unborn babies died, and several mothers too, after urgent non-COVID-related surgery was delayed for days. There's a reason these horror stories are emerging here, in South Africa's Eastern Cape, a region that's become synonymous with misrule. To be clear, this is not about a poor region being suddenly overwhelmed by an unexpected virus. No, this is about a pandemic exposing the rot here, the years of epic corruption and mismanagement. At Livingston Hospital, for instance, derelict buildings, absent bosses, and even before COVID, staff numbers at half the desired levels.
Mismanagement, corruption, maladministration have all led to us being in this situation where, in the face of a global pandemic, the health system is crumbling.
We are able to overcome.
But the man in charge of health here tells me that's not the case.
The health system in the Eastern Cape has not collapsed.
Well, we've been told quite the opposite from people on the front lines. And one thing they do say is that this has been a long time coming, that this is years in the making.
Very clearly, there is a need for really reinforced healthcare system. We knew that when the COVID came up, we needed to really prepare ourselves, and we've been working on that preparation. I think we are still on track.
On track? The arrival of a team of army medics suggests otherwise. Urgent reinforcements for a battle against a virus that is exposing South Africa's institutional rot. Andrew Harding, BBC News, Port Elizabeth.